Of all the issues the world faces today, poor mental health is one of the most prevalent in adults. The National Center for Health Statistics, NCHS, as part of the Centers for Disease Control and Prevention, reported that an average of 18% of adults between the age of 18 and 65 experience symptoms of depression, and specifically adults between 18 and 29 experience symptoms at a rate of around 21%. As with many things, during the COVID-19 pandemic, this has just gotten progressively worse. COVID-19 has impacted people's lives in many different ways, such as job loss, social isolation, and overall change of lifestyle. And it is something that nobody could have accounted for when it happened. The combination of all these negatives the pandemic has brought has led to a drastic change in the mental health of the world's population. In a CTV news report, it highlights that even just in Calgary, suicide-related calls to helplines are up 66% from where they were just before the pandemic. This was in October of 2020 compared to October 2019. In another article by the Toronto Star, it mentions that 1 in 10 Canadians has contemplated suicide during the pandemic. These results are coming from a survey done by the Canadian Mental Health Association. So, with the pandemic still impacting our lives in such a drastic way, how can we combat the negative mental health effects it has forced on people? One outlet that has worked before the pandemic and has continued working during it is physical activity. But how does physical exercise help improve mental health? Well, in a published article from the Primary Care Companion to the Journal of Clinical Psychiatry, written in 2006, it highlights several benefits that physical activity has on an individual, including improved sleep, increased interest in sex, better endurance, stress relief, improvement in mood, increased energy and stamina, reduced tiredness that can increase mental alertness, weight reduction, and finally, reduced cholesterol and improved cardiovascular fitness. In addition, physical exercise improves mental health by reducing anxiety, depression, and negative mood by improving self-esteem and cognitive function. Exercise has also been found to alleviate symptoms such as low self-esteem and social withdrawal. Obviously, this is not the only way to combat negative mental health, but it is a way that can be done even during the pandemic. There are various ways that one can begin to engage in physical activity. With spring and summer right around the corner, going outside for runs, bike rides, and hikes is a very COVID-safe way to practice personal fitness. Another good way is to look up various different home workout guides available online, as they make it easy for anyone to start improving their physical and mental health. And to top it all off, not all gyms are open, but for those that are, practicing safe and sanitary physical activity at these locations is an option that provides a multitude of different ways you can work out and do physical activity. COVID sucks, and I believe that we can collectively agree upon that point. It has impacted everyone in a litany of negative ways, but there are many other ways to combat, at the very least, the mental health effects this pandemic has had on us. And hopefully, you consider safe physical activity as one of these ways. Thank you all very much for listening. Stay safe and stay healthy.